Bonjour, comment ou plutôt bon après-midi ou bonsoir. My name is Sandrine Batsonga and I'll be presenting my reflections on Malcolm Gladys' cause about engineering programs in developing countries. This is a lead courses and from a student's perspective. Before getting into the commitments that I have gained from this class, I would like to thank you, Mr. Reddick, for taking the time to attend this virtual presentation, and I'd like to introduce myself. So again, my name is Sandrine Batsonga and I'm a final semester MPH candidate in International Health at Boston University School of Public Health with an emphasis in maternal and child health and program management. I have a strong interest in maternal mortality and malnutrition in international settings, and I would really like to work in program design and implementation in low resource communities once I graduate. I have experience working in Burkina and Haiti as a public health intern and at Howard University as a research assistant at the School of Pharmacy Department of Pharmaceutical Sciences. So for the past few weeks, my group and I have been working with Farm Access Namibia, and specifically with their mobile clinic services program that they call Mr. Sister Clinics. So Farm Access is dedicated to improve access to quality healthcare in Africa for low-income groups by strengthening the private healthcare sector. Mr. Sister Clinics provide wellness screenings and primary care to people living and working on farms, other remote population, and people living in informal settlements who will not have access to health services or easy access to health services otherwise. So, what is implementation? If I were to answer this question for my grandmother, I would probably say that implementation is similar to walking into a room confident and sure of one's abilities to produce quality work and experiencing disenchantment within minutes by your dense scope of work. More seriously, my definition of implementation will be that it's a challenging task of translating into concrete steps objectives that do not always perfectly fit with the realities on the ground. Objectives can be unrealistic, simplistic, unfeasible, unclear, incompatible with the stated budget or timeline. To my understanding, the implementation process includes understanding the scope of work or proposal to work on, a clear analysis to understand what are the terms used to make sure that everything is defined in a common language to understand the organization, the structure, and so on. And the next step will be to draft, to actually design what is being asked, refine it by after peer editing or running the idea through the organization that requested it, and then finalizing the product and delivering it. So this presentation will be a review of the assignments that Malcolm and Farm Access have given my team and I during these past weeks, and it includes a work plan, human resources management, quality improvement, and health assignments. So our first assignment for Farm Access was actually for Malcolm was to design a work plan, an annual work plan for the Malawi Health System Strengthening Project proposal. And I like to call work plan the art of decrypting someone else's mind. So my teammates and I were tasked to draw an annual work plan for this project. In a week, we had to form a team, trust each other, to work collaboratively and efficiently, and actually come up with a quality work and a 20-minute presentation. Our work plan included clarifying the goals and objectives of the proposal, the activities to be conducted, a monitoring plan, a Gantt chart, and explain the resources and constraints that this proposal might encounter. So needless to say that there were several challenges, but also a lot of lessons learned for this task. The first challenge that I mentioned before was the actual team forming, getting to know each other, and readily soon after getting to work together, assigning roles, trusting each other, and the limited time that we had to form our team and actually create a work plan for a proposal that we had never read before. And it was a challenge to actually understand what the authors really meant when they were writing that proposal. But we did learn a lot of lessons, especially about feasibility. I I come to learn that if a proposal is too ambitious, one idea, if one has to implement it, will be to scale it down. For instance, start with delivering services to one village instead of the three mentioned in the proposal, and then scaling up the activity after a certain period of time where initial barriers have been overcome or some effectiveness were measured. Also realize that within a year or initial year period that the one we had, all the activities of a program can now be launched. And I also realized that an effective monitoring and evaluation plan should come with any work plan as the basis for potential scaling up, additional funding, program extension, or assessment of programs' impact. Our second assignment was from PharmAccess, and PharmAccess tasked us to actually design a check manager position. Check stands for safety, health, environment, and quality assurance. So we were required to come up with a job description, a personal profile, salary range, interview questions, and scoring sheet, as well as newspaper advertisement for this position. It was really interesting because I personally, as most of my group members, were not fully familiar with safety, health, environment, and quality assurance, and it required searching about this job and the requirements for this position, and really putting it in the context of Namibia, so knowing what were the Namibian certifications for that position. And also, in order to improve the quality, PharmAccess reached to us to improve their patients' awareness and knowledge of their rights through pamphlets, acknowledgement form, and an exit questionnaire. The thing that I really learned from this module was the concept of a process map. So basically, I came to learn that a process map is to implementation what a logic model is to monitoring and evaluation. So before getting your head into a work, you need to know where you are, where the organization is actually, where the organization wants to be, assess the current pathways, and determine changes to be made or stops to add on the existing trajectory and the existing map. So in order to improve the quality as well, we also designed a mHealth, eHealth feedback system, patient feedback system for PharmAccess. PharmAccess access to draw on the text messaging system that they already had to design a system that will help facilitate a procedure which allows patient to lodge feedback or complain, and also for the staff to be responsible to receive this SMS and act on it. So we decided to create the voice patient feedback system, and it encompasses a tablet on mobile clinic sites for all patients and a text messaging option for cell phone users. Throughout this work, we realized all the potential issues that such a project might encounter, including network issues, power outages, cultural adaptability, reading competency, tech literacy, and cost. And the system that we designed really tried to overcome those with the tablet. Network issues, power outages could be overcome. We decided to recommend PharmAccess to use a community liaison that will help